So let's talk about fibroids today. And what is a fibroid? The smooth muscle tumor inside the uterus is called as fibroid of uterus. Is called as fibroid. Also called as leiomyoma. Okay, yeah. So leiomyoma is a smooth muscle tumor deriving from the myometrium. So what are the parts of uterus? So this is the endometrial cavity. This lining is endometrial lining, and the muscle part is called as the myometrium. This is cervix after the narrowing, which is called as isthmus, and this is cervix. So when we are taking pap smears, this is the region from where we should take pap smears to eradicate or to rule out CA carcinoma cervix. Of course, these are ovaries and these are fallopian tubes. So let's talk about the locations of fibroid. So when we are saying fibroid, then there are locations which are important or of supreme importance clinically. So just remember three locations: intramural, subserosal, and submucosal. To remember, this is the least aggressive, and this is the most important to diagnose as it can cause a lot of bleeding. So now let's talk about the locations. Start with intramural. So this is a myometrium, and what mural means? Mural means muscle. So inside the walls of myometrium, if fibroid is there, that's called intramural. If it's on the lining, the outer lining of the uterus, distorting the counter of the uterus, you can see that there is a bulge which is abnormal and not matching the original contour of the organ. This is called as subserosal. And when it is inside the endometrial cavity, it's called as submucosal. And this can lead to bleeding, this can lead to abortion, and this can lead to a lot of problems and even pain. So these are the locations. Best investigation modality to diagnose fibroid will be USG, ultrasound. What about the blood test? No, they are not helpful. Blood test cannot diagnose fibroids, but ultrasound can detect fibroid and its location. What about if the fibroid is there in this area and connected by this small stalk? And this kind of fibroid can cause pain if it is pressing on some organ or anything nerve. So this type of fibroid joined to the uterus by the stalk or pedicle will be pedunculated fibroid. Pedunculated fibroid. What about the fibroid which is present in the cervix? So if fibroid is here, then it is not a uterine leiomyoma, it is a cervical myoma. Cervical fibroid. This is how we diagnose. So just to revise, if it is intramural, then it is in the walls of myometrium. Inside the endometrial cavity, it's submucosal. Outside the outer lining of the organ, uterus, it is subserosal. If it is in the false pelvis connected by the pedicle or the stalk, that's pedunculated fibroid. If it's in the cervical area, then it's cervical fibroid. And ultrasound is the diagnostic modality. Blood test cannot diagnose fibroids.